All right, folks, I think we can go ahead and get things kicked off. My name is Derek Coy, and I'm the Veterans Health Officer here at the New York State Health Foundation. I'd like to first start off by thanking you all for joining us today. As things are beginning to open back up here across New York, I know a lot of you folks still have a ton going on, so we really appreciate you joining us here today. Also, I'd like to be sure to thank our incredible guest, Dr. Kavita Patel, for joining us today to talk about vaccine rollout, the veteran community, and everything else pandemic related that we can jam into a short discussion. For the very few that don't know Dr. Patel, she is a non-resident fellow at the Brookings Institution and is a trained primary care physician with a super impressive resume that would take up our whole hour, even if we read even an abridged version. So we encourage you all to check that out when you get a chance. But since we only have an hour, I'd like to jump into it. But really quickly, a few housekeeping notes. This webinar will be recorded, so we'll be sure to circulate a recap email with the link to the full bio or full video in the coming days. Also, I'd like to hog all of Dr. Patel's time during this webinar, but we will have some time for audience questions and would love to hear from you all. So feel free to submit those into the chat box throughout the conversation, and I'll try to slip them into the conversation when I can, or save them for the Q&A portion at the end of the webinar. So with that said, we can actually dive right in this time. Dr. Patel, thanks so much for joining us. We're really excited to have you here today.
Thanks for having me, Derek. Call me Kavita. I respond to Dr. Patel inside a clinic only, and usually about 30 minutes late. So on this webinar, I'm on time, and please call me Kavita.
We appreciate that, and I promised I'll try. So it does seem like it was just yesterday, but in late February, you joined our friends from Iraq and Afghanistan Veterans of America and Team Rubicon, two amazing organizations that are both grantees of ours, and they make up 1/3 of the Veterans Coalition for Vaccination. So you joined them for a conversation right when vaccine rollout had kind of just began. And there were a certain air of optimism mixed with a healthy dose of skepticism at the time. But I think a lot of the things we've experienced this last year, kind of similarly, everything seems to be moving really quickly and nothing is certain. So now that we have some time to look back, can you give us an overview of how you think the initial vaccine rollout had kicked off?
Yeah, so, and I'll be brief because I know we wanted to get in some nitty gritty, and these webinars, we're all kind of now used to doing these, but I would love to see if the people that are kind of watching live ask any question. Nothing, I like to say there is no stupid questions, and usually I'm the one asking most of them, so don't worry about it. But I would say compared to February, from now till in February, several things that stand out. Number one, I do think that the vaccine rollout has gone better than I would have expected when President Biden originally set the kind of 100 million shots in the first 100 days. I can tell you, I was even quoted in the press for saying that, like, hey, listen, I would love to go lower and then just kind of overachieve, try to undercount it and then kind of exceed on operations. We have over exceeded that. However, as we talked about in February, it was like a mad stampede, which continued pretty much to April, Derek, to find a vaccine, from kind of Twitter accounts, Facebook, Instagram lives, to kind of help devoted 24/7 to getting people shots. We kind of saw this like drop off pretty much. I can time it to like the day in April when all of a sudden it felt like, okay, I can go anywhere and get on any website and get an appointment. So from an ops kind of like implementation, if I had to give us a grade in like January, I would have given us a D, maybe a generous C+ in some states. By February to March, that kind of went to like a C- and a B. And then now we're like, now I'm giving it an A because you can go anywhere, including any retail pharmacy and most clinic offices. Mine now has Pfizer, Moderna, Johnson & Johnson, which sadly we've had to throw away because nobody wants it. And number two, it expires after a while. So that gives us like kind of, we have to like take a moment as a country and just be proud. Any of you who were part of getting people vaccinated, you really do need to take a moment, really be proud of where we're at. I was, for Father's Day, went outside, outdoor seating because my kids are not vaccinated, outdoor seating for like a brunch yesterday. And, hand to God, it felt like it was pretty much normal. I mean, people had the wait staff had masks, but you could have taken a picture and then just said this was June of 2019, and I would have believed you because that's how it felt. So that doesn't happen without a vaccination effort that is literally kind of, to be rival to no other countries to date, maybe save Israel. And I would say that science gets the first dole of credit for that. So that's my observation. However, with that comes a caveat that I'm a little nervous that because, as I mentioned, things look so normal, or it feels like it's not so bad anymore, and our memories, for whatever you want to say it, our memories, including mine, are short, and we kind of don't remember where we were a year ago and how kind of our country was either getting battered or kind of dealing with this and truly, getting the brunts of this. I don't know if we are going to have some of our past mistakes haunt us. Vaccine rates in some parts of the country are in the 20s and 30s, and that does spell disaster. And I'll be even more kind of to the point. I would say that if you're not vaccinated right now and you're eligible, if you're not vaccinated, it's just a question of how and when you want to get infected. And I know that sounds overly dramatic, but it's not, because this is a virus. This is what it does. And so and when you're dealing with a more transmissible, potentially a more pathogenic virus with the variants that we're dealing with and ones that we don't even have the names of yet, that's real.
Yeah, no, absolutely. And you touched on so many things there that I think are just critical. They're super important, and they really do provide great segues into future discussion. One in particular, I think, just the idea of looking at the country a few months ago where it was like the Wild West. You mentioned you hear about all these like heroes that are creating bots on Twitter and people giving up their vaccination appointments to like an elderly person, and that seems like it might as well be 20 years ago, but that was just a few months ago, and it's
Right.
really hard to really believe that. And speaking of just a few months ago, we in the military, we love a good acronym, and we'll never pass up an opportunity to use one. And one that you all used last time was BLUF, bottom line up front. What's kind of really happening? And I think you did an excellent job of explaining that a few months ago. But since things have changed, you kind of alluded to a few things, ebbs and flows in rates and how we're feeling things being back open again.
Right.
So what's the bottom line up front now? Where are we currently at? Is this
Yeah.
the
Yeah.
time to rest and say, hey, we did a lot, but we still need to do more, or hey, we haven't even scratched the surface? Where are we currently?
Yeah. So kind of, I do love it. And by the way, I was raised in San Antonio, Texas. So I thought life around in military bases was just very commonplace. So I kind of have used the bottom line up front from a very young age, and not realizing like, oh, wait, that's like a thing that other people don't necessarily realize. So the bottom line up front now is that cases are dramatically declining. We had about 10,000 cases in the last 24 hours, largely in people who are unvaccinated, also skewing younger. Average age of new cases is about 26. So and then we have consistently seen declines in deaths, which is incredible and wonderful. We're seeing deaths past 24 hours, about 100 deaths. So, compare that to where we were, and obviously we've made incredible progress. Vaccination pace, there's people talk about like the average overall in the country. I would say that depending on where you live, metropolitan areas have anywhere, Dallas, Texas, 48% of the Dallas metropolitan area is vaccinated, compared to parts of Connecticut, which are at about 76%. So this does vary, but blended average is about 2/3 of the country has been vaccinated, or at least has received one shot. And let's not mistake that bottom line up front, that's what's driving down the numbers. I mean, we can talk about masks and all these things make some difference, but for the most part, those mitigation measures are gone. It's hard to even find a part of the country where they're mandating any sort of masks, or kind of most people leaving it up to vendors and business people to decide if they want to have anything, which most people are kind of erring on the side of caution and requiring some form of indoor masking, especially if you're not vaccinated. But we're doing a lot of the trust factor. And then where do I see threats? Kind of, again, the Delta variant's getting a lot of news play, but it's very clear that it's whether it's the Delta variant or the Lambda, which is the one that's next up and has been identified by the World Health Organization from Peru, whether it's one versus the other, they're each time we get a new variant, they're just a little more infectious, a little easier to catch. And so it's leaving us with some very big dilemmas about how we are going to go into the fall. Warm weather, we know that this virus in our country has tended to kind of have a lower level of activity with warm weather. It also makes right now what I would say is kind of that golden moment where cases are incredibly low in most parts of the country, still decreasing. And you can have like safe outdoor activities, even indoor activities with unvaccinated people when cases are this low. That trend could reverse as we get closer to the school year starting and more of the indoor kind of gatherings. And where we have seen outbreaks in the United States have been in youth, in unvaccinated places that have kind of been more crowded in.
Gotcha. And so I think again, just the idea of looking at how much has changed over, of course, like the last year plus, but in particular these last few months, a lot just seems crazy, for lack of a better word. Everything just seems crazy now. How the bad stuff seems crazy, the good stuff seems crazy. And looking back when you were discussing or having this conversation with Jake and Jeremy, there were two vaccines at the time. This was, I guess, pre Johnson and Johnson, or finally officially been rolled out. And now we possibly have a fourth with the Novavax. The trials seem pretty promising. So my question to you, just based off of something you just mentioned with Johnson and Johnson folks, has a shelf life. So one, how kind of miraculous was it that not only were we able to create like just one vaccine, but three pretty efficient vaccines? And then on top of that, is it okay to keep producing new ones, or should we be investing in like the few that work and getting them to as many folks as possible?
Yeah, great question. So none of this would have happened without not just putting literally billions of dollars towards Operation Warp Speed, which really fueled all of these manufacturers. And in Operation Warp Speed, we had over a dozen manufacturers. So, some made it through, as we've seen, and then some are still in the pipeline. So it's to your point, Novavax, others, there's still kind of a significant number of potentials. That wouldn't have happened without dollars, but also the kind of combination, kind of full kind of force of government in all aspects, regulatory, and almost every NIH researcher kind of turned their attention towards helping to kind of, focus on vaccines and COVID therapies and understanding what to do literally about the coronavirus. So that would not have happened. To your question, though, it's interesting. I think we have to continue to push on what we've committed to, not just in funding new manufacturers, but even attracting other manufacturers to come into the vaccine pipeline, because one, the world needs it. So we cannot make enough for the entire world. We have enough for our country, but making these vaccines, no matter what type they are, doesn't just happen overnight. Between raw materials and supply shortages, similar to what we saw with like mask shortages a year ago, all the way to just the process of manufacturing and the oversight and quality control that it takes. It's an intensive process. Yes, each of these companies, Pfizer, Moderna, AstraZeneca, can make like 100 million vaccines in a month, but we've still got billions of people to vaccinate. And it's actually in the United States global interest to have everyone vaccinated, because how are variants emerging? They're finding reservoirs in these huge pockets, huge countries that have gotten nowhere near the vaccination rate we have. So I think it's important to consistently have a strategic view on COVID vaccines, and that's going to help us going forward, because we just don't know what the future looks like, but now we can be better prepared for it. And I'll add into that, it's also just as important, it doesn't get enough attention, Operation Warp Speed included money for treatments. So we are now finally in a phase where if I, even as a vaccinated individual, if I got infected with a breakthrough infection, there might be, Derek, like I have an HIV, for example, a pill that I could take to prevent it from taking hold inside of my body. So those are important therapeutics. Those are incredibly, like in my mind, the learnings we will get from not only developing those and saving people's lives potentially, But what's great about what we're seeing with mRNA vaccines and some of these other technologies is that we're going to try to apply those to some of our conundrums of problems, everything from HIV to Ebola to the common cold. And we could have done this before. In fact, some of these vaccines and this technology has been tried before, but nobody has ever put this much attention and money and kind of funding towards it.
Yeah, I think similarly, so many great points there. And I think of the saying, no one wins war except for medicine. And I feel like this last year has been like a war. We've been waging a war on something that's been obviously, taking a huge toll on so many folks. And that is one of the few bright spots. And I didn't really think about it until you mentioned it right now, that obviously this is great for what's happening now, but what this will lead to and bridge to in the future, that is, certainly encouraging in some rather dark times. And I can't talk about vaccine rollout with discussing vaccine hesitancy. I think that's a huge, part of what's going on here, which we certainly, kind of discussed a little bit here. And that seems to have ebbed and flowed over the last 6 months. I think there were a lot of questions regarding, is there enough demand or is there enough supply? And we've seen both of those kind of fluctuate. And I think you're seeing this a lot, especially in the military and veteran community.
Mm-hmm.
So can you speak to kind of where folks are regarding their comfort getting vaccinated? And then, is hesitancy, is it being reduced? Are there new factors that are creating it, like we saw after the Johnson & Johnson, kind of scare, if you will? Can you speak to that larger trend, if there is one?
Yeah, so I do think, especially when people were kind of literally clambering over each other to try to get a vaccine, it was really noisy to try to figure out, well, so who amongst us are hesitant? Because it feels like there's so many people who want it, and certainly there weren't any slots available on any website anywhere, and so you couldn't really parse out, like, so who is the population that actually could get it today, now, and doesn't want it? Now we can do that. And we do know, when I mentioned that, like, on average, about 2/3 of the country is vaccinated. So who are the other third?
Mhm.
Well, in that other third are children who can't get vaccinated. Let's take them out of the equation for a second. And then we look at anybody age 12 and above who's eligible and has not received a vaccine. Like all things, it's complicated. You see kind of three themes that have emerged. Number one, which is, I think, a lot bigger than people realize, are just people who are not anti-vax, they're not anti anything, anti-science, they're not even political about it. They just want to wait and see because they just feel like it's too new. I think that's a huge part of what's driving kind of, I don't even know if I can call it hesitancy, because they definitely want one. They
Mhm.
just aren't sure they want one. They're sure they don't want one right now, and they're not sure when they do.
Mhm.
Then there is a second group, which is truly, like, also kind of not anti-vax, not anti or pro anything. They're just concerned about safety, and it's not the people who want to just wait and see how much time it's going to take. They're more just concerned about safety because they've been hearing, media reports about this, and I think this is where misinformation really feeds into it, effects on fertility and all these things that are not true. And
Mhm.
then there is a third group. It's hard to quantify, like, how large it is. There's certainly a source of a lot of misinformation. There is a third group that is never going to get the vaccine, just never vaccinate. Maybe they don't do that with other vaccines, but with this particular vaccine, they have strong beliefs. And I will tell you, I've now had experience, and there are other groups, but that's a large majority of drivers. And I've had experience in my population with all of the groups. And then I used to work in a veterans population predominantly, and kind of getting ready for today compared notes. And it's interesting, the Veterans Administration has higher rates of vaccination. And I think it's because, number one, there's just, from people such as yourself and Jeremy and others and Jake and Rubicon, there is a tight community that I think kind of coalesces and tries to push out the misinformation. It always breaks through, but then tries to really also identify the kind of facts and the bottom line up front. And I do think, unfortunately, we saw so many veterans die from COVID that people have, it's hard sometimes to find someone who knows someone who died. When I talk to a veteran, all of them, almost to the script, know someone who has died. So that's, I think, driving it. But to get to the remaining who are vaccine hesitant, I've had to use just my kind of advice is it takes multiple kind of bites at the apple, so to speak.
Mhm.
And I really try hard. If it's a 22-year-old young woman who's really worried about effects this could have like on a future pregnancy, like I'm older than that and I've had kids, but me telling her, don't worry, it's okay. She knows I don't live and walk in her shoes. So I try to find someone. So like I'm a medical assistant. And by the way, a lot of the remainder people are persons of color, might skew a little more female. And I think it's because of some of the concerns I listed. And so I try to find someone that kind of looks like her, has the same life as her, and can relate to her. And I think this is actually where veterans can play a huge role because nothing will kind of nobody knows kind of the journey and the path that someone has walked through other than than somebody else who has had a similar path, and that can be really compelling.
Yeah, absolutely. I think you similarly, it's the same. There's just a lot of great points there, and it's not as black and white. It's not as easy as to say this group or this number. It really does
Mhm.
vary. And in myself, being a veteran, I'd consider myself super pro science. Like anywhere I think the scientific community would lead me, I'd be happy to go. But even I was still like, I'm not really sure. Like if
Right,
I can just quarantine, continue to keep what I'm doing,
right. Why
be
need?
safe,
Right, right,
then it's just not going to hurt to have some more time.
right.
But I got a text message from VA. I was in
Uh-huh.
Houston at the time where I grew up. And they just said, hey, do you want to get vaccinated? We got some slots open. I mentioned, oh, I'm not in New York. I happen to be at my parents' place. They're like, well, you can go to the VA there. And I'm like, you got rid of all my excuses.
Right,
I can hug my mom in 2 weeks. Like, yeah, I'll do it. That sounds good.
right,
But before then, there wasn't anything that was making me say, no, I don't want to get it, or anything that made me feel like, yeah, of course I'm
right.
going to get it. It was just like, I just, and I think, like you mentioned, that's probably the case for a lot of folks. It's not
Yeah,
as
I
logical,
do.
political,
Yeah,
and
I think you're reflective of the majority of people who haven't been vaccinated today. I just think the tension now is, I mean, it would be interesting to, kind of line up 10 COVID experts and react to the statement like, if you're not vaccinated today, then you will get infected. It's just a question of when and how. And I think that that drives home, yes, you can continue to do, if you're staying at home and and by the way, masks, I think as a myth, masks protect other people from you. And so it only really works when everybody's masked. That's why some people have asked me like, oh, why do you wear a mask indoors? And I said, honestly, I mean, the chances I am infected after a vaccination are so low, but they're not zero. And I can't help but not know who's not vaccinated or not around me. And so I wear a mask indoors when I'm around kind of strange people whose vaccine status I'm not aware of or whose chronic condition status I'm not aware of. And it's because, in order to kind of keep yourself safe, if you're not vaccinated, or if people in your group are not vaccinated, you kind of have to go back to like all those old measures that we were frankly pretty tired of.
yeah, I think, like you mentioned, military veteran community. I think there are a lot of things that you know kind of bond us together. A lot of experiences that we've gone through, and that seems like the no-brainer because in the military, pretty much no matter what you're doing, you're gonna have like some like dumb part of your job where you have to like carry a pack for a long time or wear something you don't want to wear. It's just par for the course. And I think for a lot of us in the space, like you mentioned, I don't know what my chances are. It's probably low that I have it now, but if me wearing a mask, it's not going to hurt me. It's certainly not going to hurt you. It just doesn't bother me. And I think a lot of folks
Right.
are more like that now.
Yeah.
And I think you kind of already discussed this, but I want to see if I could tease it out just a little bit further. Um, one thing that we've been really excited about at the foundation is in supporting Veterans Coalition for Vaccination, in particular folks at Team RWV and IEVA, because we knew like when these conversations we're having, we need to get shots in arms. That's paramount. So we were happy to look into how we can best do that. And so we supported those efforts. And one thing that I feel like it's not super clear now, but we wanted to increase vaccination rates in the veteran community. But as you mentioned, that's a pretty diverse community. It's hard to say,
Mhm.
well, are they rural? Are they urban? Are they, part of an ethnic minority? Are they women, member of the trans community? All these things vary. So again, I think you answered this, but just in case we can flesh it out further, is there a community that we can call a community and say they've done it well, or they have maybe made things more difficult or good or bad? Is that something we can do, or should we just look beyond that?
No, it's a great, and I do think the veterans community, by the way, I'm going to highlight something that the Veterans Administration, as well as a number of kind of veterans community-based organizations, did incredibly well at the beginning of the pandemic. And then also, in addition to vaccination, by the way, like the text message, kind of that communication loop you got is just one great example. But even in the beginning, the Veterans Administration was one of the first to easily be able, when we had the stay-at-home orders in March of 2020, to be able to pivot to kind of almost all virtual health. And that's because doing things through telehealth has actually been like a very natural component of the Veterans Health kind of administration and how they deliver health services. Going to like 100% overwhelmed, like my own hospital and clinics, but for the VA, actually wasn't as overwhelming. And I think it was something that really we have to look for as an example and what's worked well in healthcare, so to speak, during just kind of a really dire time. Other organizations, I'll highlight that. So some of the Native American organizations and tribal nations, as well as components of the Indian Health Service, but mostly led by tribal nations who really did kind of their best to do both contact tracing and testing. But then when vaccines kind of were available, and many of them had vaccines available through mechanisms of different supply, actually like took the vaccine to the people. This wasn't, because we were seeing higher rates of COVID infections and deaths in kind of Native American tribes, Native American populations, even off of tribal lands. And that really was like kind of another reflection of the health disparities we've seen across COVID. But they had done, and especially like the Pueblo, there are specific tribes that had really taken, we're going to bring this vaccine to the people. Like, we know that our people are skeptical, they're tired, they have been overstretched and kind of underserved for a long time. So we're going to bring it to them. I think that's I think that, and I'll also point out that we saw a lot of like private sector companies. I think what Uber and Lyft and some of the rideshare companies, and I think it's still going on, if I'm not mistaken, even things like free rides to vaccines, as well as employers. There have been some employers, McDonald's, Starbucks, to name a few big ones, and then smaller businesses that allowed for people who wanted to get a vaccine for workers to carve out like a 24 to 36 hour period after the vaccine. I personally had like a pretty horrifically, I was down for 36 hours after my second shot. And even though I knew better and I knew that that was a possibility, if I had to like go in and deliver patient care that following day, it would not have been good. So those are exemplars. By the way, I've been kind of really curious to figure out how we can take those lessons and apply it to other parts of healthcare, because I've got, 67% of women who have missed a mammogram this past year. We've got kids who are behind on vaccinations. So why are we resting on like our very traditional methods? Why not reverse and flip the pyramid and take some of these great lessons and apply them into these other settings? And I hope that, as I mentioned, telehealth and the VA leading, I actually hope that it's interesting. I'm looking at the national numbers, and we're watching now the rate of utilization of telehealth visits is going down, and as things are kind of appearing back to normal.
Mm-hmm.
I hope that actually doesn't stay, because I think there were a lot of aspects of telehealth that were incredibly convenient and allowed for better care, because most of the patients I had that I couldn't get come into clinic, I was able to get them like during their lunch breaks at work, and able to get them on the phone very quickly to talk about their meds. And so that was not exactly what you asked for, Derek, but I think that there have been organizations and communities that have led. And then there have been these micro kind of hyper local approaches, all of which come around that theme that you identified in your own experience: convenience, kind of friendliness, consumer centrism, people understanding like, no, people don't have like nothing better to do than schedule things all day and try to show up to an appointment that's totally inconvenient to get to without transportation. So I think all those things come to bear. And again, I'm worried we're just gonna, we're doomed to repeat our history if we don't learn from it. So hopefully we will learn from it.
Yeah, I hope so too. And I think not only did you really touch on what I was hoping that you would, but I think you broke it down in greater detail, which is really helpful. So I look back and I think there was a Scientific American article, and you could find this in a lot of different places. But after Elvis was vaccinated in front of millions of people,
Mhm.
vaccination rates went up 80%, I think, in 6 months. And I
Right.
think that's a cool thing to look back to then, but different country, different virtually everything.
Mhm.
And I kind of did expect that there would be this one, I don't know, Taylor Swift get vaccinated and everyone's, I don't
Yeah.
know what it would be. But
Yeah.
that's clear that's not been the case. And I think because, like you mentioned, one is not that simple. It might have worked then, but now things they're not as, monolithic. It's broken
Mhm.
down by communities. And
Mhm.
I think, like I said, that's what I was kind of hoping for, maybe. And that clearly is not the case. But you touched on something else really important, what VA has done. And I think a lot of folks ask, like, hey, how's vaccination in the veteran community? What's VA doing? And I think that's an important question because of their fourth mission. They're like the emergency backup
Mhm.
health system. So that's incredibly important for what they do. But on top of that, I think VA's done a pretty stellar job, all things considered, with their vaccine rollout. And they're barely at like 2.7 million vets vaccinated out of, we'll just say 17 to 19, depending on the estimates. And I think people don't realize like veterans care is private care for the overwhelming majority of the care
Yeah.
that they receive. So I always thought like, oh, this is great. VA is doing well. So this must mean something with the private sector. And there's really no comparison. Do you
Right.
feel that there are groups like this when we talk about vets and vaccination? We're really only talking about VA because is anyone else tracking like demographics or better, demographic info on vaccinations?
On vaccination, let me be careful to be specific. Demographic information on vaccination rates amongst particular populations or
Say
overall.
veterans in particular, like, do we even
Right.
know of how many veterans are
No.
getting that? Yeah, okay, that's it.
Yeah. No. No. And I actually tried to do some research. Like I said, I could not find like a great for all the state vaccination and local vaccination websites, of which there are plenty. I didn't see any kind of more detailed information about like, which are veterans or how, any sort of even like kind of delineation, for example. And I actually talked to a couple of state leaders and they said, well, no, the VA actually received like their own kind of special kind of allotment of doses. And so they're doing distribution. However, obviously veterans can sign up and go to CVS on the block if they don't have it available. They're not limited to that. And so it's been interesting, Derek, because I have wondered, do we know how many of those remaining of the kind of total millions of veterans do I know that some remainder of that has received vaccines through other sources, but to your point, I don't have a good way of knowing then what's the full numerator of people who remain to be vaccinated. And I think that is critical. That is actually a question I was trying to get some better answers to, but because to your point, we're not really tracking it that way. And
Mhm.
so it brings up, it's an age old conundrum because when I used to do kind of my daily job used to be health services research, we would often talk about, we ask in questionnaires if someone's a veteran for many job questionnaires, for many health status questionnaires. It's been part of kind of screening tools to check for PTSD, anxiety, kind of a lot of other kind of tools that we use. But we haven't necessarily drilled and then thought about as a special population, how are we tracking that at a national level? So it raises like a very good point. And I know that the current kind of what I'll call like, Washington, D.C. based leadership for the VA has had a very smart, stellar group of people at the national level who have kind of come in, specifically been brought in by the Secretary of the VA to kind of deal with COVID, people having vaccine hesitancy issues, vaccine supply issues, and I'm hopeful that there will be. I had heard that there will be some like kind of emerging papers or lessons from that. I'm hoping that happens in short order because I think there's still a lot we can learn. And if we have to get boosters or a third shot or whatever it is that we're going to need, which is highly likely at some point in the next year, we're going to need those lessons so that we can actually understand, well, how many veterans do remain unvaccinated? What are their barriers? Is it because of a perception that they can't get it somewhere or what we talked about? And
Mhm.
we don't have those answers. Maybe some people watching do, but I haven't seen that published anywhere.
Yeah, I'm really hoping so, because I think it'd be incredibly important and something we could build off of for sure. And it makes me think of another question, and I think similarly, I think you might have kind of answered this, but the idea being, when we look at things like, we'll just say like suicide or the opioid epidemics in
Mhm.
particular,
Mhm.
both egregious, like no one's arguing that. But I think one thing that gets lost in the sauce is, like we talk about, like accidental overdose. Was that a suicide? Was that an
Right,
overdose?
right,
With opioids, was it the opioid that killed you, or was it mixing with alcohol? So like
right.
all these caveats, and same with suicide, and I would say same with COVID. And this is something that's just been, I would
Mhm.
say, just be candid, like has bothered me this last year, because I live in the Bronx, and it
Mhm.
has, through the roof asthma rates, really high asthma rates,
Mhm.
least healthy county. I grew up next to a chemical refinery in Baytown,
Mhm.
Texas, and I was exposed to burn pits in Iraq. So if I had lung issues, I can't tell you if it was because of COVID or Iraq or
Right.
living in the Bronx or Baytown. And I feel like those are the things that are getting lost. So that being the framing for a question, do you feel like we actually know, like, the impact of COVID? Do we know how many folks have died or had it, or how big of a pandemic this actually was? Or do you feel like at best we're just estimating?
No, it's a great question. And I think that, I do not think we know the real number of anything right now. That includes deaths as well as real cases, because
Mm.
we've been making assumptions off of like kind of positive cases, but we know that there are people who had never been tested, who might not ever even have had symptoms, who were positive, could have innocently been spreading the infection unintentionally, obviously, but because they never had symptoms, never sought testing, they never even knew. And we're not at a level where we would recommend that people get antibody testing. Our antibody test itself is not that useful in that regard, to just do it kind of willy nilly and try to see if you've been infected, because the answers can vary pretty greatly. So I think that it's incredibly, like, you're exactly right. And this largely has to do with the fact that we never really adopted a national framework. And I would say the Veterans Administration did, but they were kind of at the mercy of the rest of, the kind of federal government. And at the time, we decided as a federal government, which Biden has continued, that we're gonna delegate a lot of this to the states. So states have very, shocking as this might be, states actually report and kind of document deaths differently. So even how kind of deaths are kind of literally at the time of death, the death certificate, kind of, even though that's standardized, but how and what people do and report that is not. So there is a great amount of variation that I'd say troubles me, and makes me believe, as many experts do, that we've underestimated both cases and deaths. How much we've underestimated it, we're not as off as believe it was also Peru. I think Peru had to revise their death estimates because they had kind of undercounted, or had undercounted deaths by like a tenfold. It was something insane, and I don't think we're nowhere near that. But are we talking? We don't really have 600,000 deaths from COVID-19. We might have 800,000 deaths. That's entirely possible. One thing that makes me feel a little bit better is that what you can do, since COVID is new, you can look at deaths in a given year before COVID, and you can look at deaths in a year during COVID, and you look at the differences. And it's not like we're picking up that much more cancer or that much more heart disease. So you could look at and see, and that's actually what researchers have done. And they have, based on those comparisons, that is how people have said that we've probably undercounted and kind of underestimated, because there is kind of a higher number than of the observed than expected. But when all is said and done, I think, so something that gets a little more wonkish. I've advocated for something of like a national registry. Registries can get really complicated really quickly, but we do need, to your personal point of someone in the Bronx, someone who might, and I'm just making up conditions about you, but someone who lives in this particular zip code, someone who has these particular conditions and tested positive for COVID at this particular time. We can learn a lot by kind of tracking how you do over time. And if the answer is Derek is fine, his life went back to normal and nothing seems any different, that's great. But if we find that, 2 years down the line, Derek's starting to have like more problems with memory, I'm just making this up. then that tells us something. And that's the only way we actually truly understand some of the trajectories of our most common diseases. Our understanding of heart disease comes in large part from a longitudinal study done over decades in a very small town in Massachusetts called Framingham, Massachusetts. And that has driven probably the largest bulk of knowledge about what to do about heart disease. Same thing for women postmenopausal, same thing for, I can pick a disease where we know a lot more than we did 10, 20, 30 years ago. And it comes from kind of watching populations over time. I would argue we should be doing that with COVID-19, and we should make that national. That shouldn't be optional just because you live in a state that prioritized it. New York State has legislation, had legislation. I'm not sure what happened with it on the books, but I don't think there's any reason this should be, just like the virus is not state specific, there's no reason this kind of tracking should be state specific.
Yeah, it's such a good point. I remember it was last year around March. I started reading And the Band Played On about the AIDS epidemic. I'm not sure if
Yeah.
you
Mhm.
phenomenal book. And I remember reading and like hearing about this guy, Dr. Fauci, and all these terrible things that happened and didn't contain this, really terrible virus. And I'm reading that, I'm thinking, well, at least those days are behind us. Like none of this will be relevant again. And just the Dr. Fauci stuff was just really spooky, the coincidence there. But realizing like, oh yeah, this is something that we've dealt with in a variety of different ways, some not so great, and here we are again. And I think you bringing up kind of like timing, I think that's super important and a great segue too. So I think it's been both a gift and predominantly a curse, the duration of the pandemic. Tragic, of course, because all of the terrible things that have happened, loss of life, all the issues that have come from the pandemic, of course, terrible. But I think also, one thing that has given us a little bit of insight is time. And now we can look back and see, how things have changed, what we could have done differently. So I think regarding that curse of the duration, I'll call it that. Can,
Yeah.
can, you, can you kind of update us now that we do have some time to look back? So with variants, with the progress we've made over the last, we'll just say like 4 or 5 months, like where are we currently? Are we at a stage where we need to do something big soon, or do we stay the course, or where are we at currently?
Yeah. Okay. So I'll say something kind of radical because I have no, I'm not,
Please support
I'm
that.
not, I'm not an elected official, and I don't think anybody is going to, frankly, care if I say something radical. But I'll tell you, I think we're at a time where we need to have vaccine mandates and vaccine requirements. I just think there's too many healthcare workers. There's been a lot talk of media and attention to the Houston, Texas case of a hospital that had a vaccine requirement, and nurses, doctors, and some other health care staff like walked out and basically, protested and took the case to the courts, and the judges sound resoundingly said, "You have no case here," but it might make its way to the Supreme Court, or at least try to. I think we have to have vaccine mandates in critical settings. What are critical settings? Healthcare settings. I think healthcare settings, institutions of learning, both lower and higher, including the staff, places with close contact and potential, law enforcement, correctional facilities. I would actually also argue like VA facilities to me that on the health side fall under kind of healthcare settings, but also other kind of, military bases. And the military does have controversially also requirements, but it's been interesting talking to a friend of mine who runs one of the clinical service lines at Brooke Army Medical Center, and he was telling me that there's a lot of pushback, and he saw a real high uptick in people wanting medical exemptions and religious exemptions, and when he tried to kind of confront why, it goes back, Derek, to those original feelings that we identified in the beginning about hesitancy. But I think we're at a stage in this country, we are so lucky and privileged to have an excess when countries literally, kids are dying in streets because they can't get access to treatments, hospital beds, or vaccines. We are awash in what is arguably, one of the most hands down, like kind of a miracle, if I can call it that. I think of it that way, with the development of a vaccine in a year, which I would never have thought could happen like that. But that also makes people worry, like, isn't that too fast if you thought it could never happen? So you see how this is confusing. But I would say that we're at a point where we need to have like mandates and requirements, and we shouldn't be sheepish about it. It gets easier once we have a full approval, but we're pretty much close to that. Like our emergency use authorizations and the time, we've had 2 billion people get these vaccines. So what more kind of real world evidence do we need? If you need 20 years of proof, you're not going to get it without having, again, the chance of getting infected and dying, or infected and having long-term COVID. So I think we need requirements and mandates. I have a lot of other lessons that kind of, if I could go in the way back time machine, I would do over again because they're pretty important lessons. But the one thing I think we could do now is implement mandates and requirements. I don't think it's politically feasible because it has become like masks and like COVID, very politicized. But
Mhm.
I think that we need to do it. And I think, but also, by the way, that would include transit personnel too. So
Mhm.
transportation, I think it's really hard to make. I mean, I had to get on a plane for the first time 2 weeks ago in 16 months. And I won't lie, like it was a 2-hour flight. I'm confident I'm vaccinated and I'm confident about my own health. I kind of everywhere I looked though, I felt like I saw like, oh my God, there's somebody who could, if they're not vaccinated, they're going to get infected. If they're not vaccinated, they're going to get infected. And I felt like that's just not a way to open up society and kind of feel back to normal and to kind of inspire consumer confidence. Travel is up compared to a year ago, still at a fraction of what it was 2 years ago.
Yeah, yeah, no, absolutely. I really appreciate that. And I do want to let the audience know, happy to take some audience questions. Like I said, happy to also hog all my time here, but we have a great audience and I'm sure they have some questions. So feel free to send those in the chat box. One last kind of like bigger question for you. Uh, so, at the end of this webinar, you've discussed a lot of stuff and I think it's been really important and really insightful. So if you were to have a conversation, or if I was to have a conversation with someone now who's still a little bit on the fence,
Mhm.
what's the best thing to say? Hey, if I can't have them watch 45-minute, hour-long webinar, what's like my elevator pitch? Like,
Yeah.
hey,
What's my bottom line up front for
yeah,
getting people
what's the
vaccinated? Right.
yeah.
Yeah. So I think there's, if you read Malcolm Gladwell's book Outliers, and Blink, you kind of actually see both of these elements. And the kind of summary is that we tend to make first impressions carry a lot of weight, right? So the first thing to do is not to go, what's wrong with you? Why haven't you been vaccinated? To go, oh yeah, it kind of Derek, what you did. We're like, yeah, you know what? Hey, have you been vaccinated? No. Hey, you know what? I was like actually kind of on the fence and here's why, and then here's why I did it. So I would use kind of those very real examples. And then the second thing I would do is just say, like, this is, usually it's issues around this was done too quickly and kind of pointing out that mRNA technology, we've actually used it for decades. And in fact, cancer patients use and benefit from treatments based on mRNA technology. And the reason we haven't put it into a more popular vaccine is because they were really unstable and we had to spend a lot of money to figure out how to make it stable. And guess what? COVID was that opportunity. So this is not old technology. It's kind of fact number one. And then fact number two is now that we have fewer and fewer kind of unvaccinated people, that is exactly where the virus is going. And just pointing out what I started with, we've got younger people who are getting it. And even though they recover and generally don't die the way people over the age of 65 did, we still just don't know enough about long-term effects. We're seeing too many people with, unexplained symptoms and things that just don't make sense who are never sick other than being positive for COVID. And then the third thing is actually talking about how even though you're injecting something into your body, and I think people really rightfully so take that seriously, what they're injecting, particularly with the messenger RNA vaccines, as well as the viral vector vaccines like Johnson & Johnson or Novavax, the things they're injecting don't actually do anything and don't stay in your body other than kind of tell your immune system, your own body's immune system to create a reaction and then develop a memory in case the real COVID virus comes and attacks your body. So I think it helps to say, I know you're nervous, you get that injected, and 2 billion people have had this, and there's no trace of it in their blood at all. There's no mercury in it. There's none of the things that I think get people really, really nervous. So you kind of have to hit it on all fronts. But I think the most important is to kind of walk in without the, oh my God, why aren't you vaccinated? What's wrong with you? And that immediately, like kind of Malcolm Gladwell, once you do that, you can't really go anywhere from there. So I have very much kind of I incorporate vaccine status into I've asked my staff and clinic staff, for all of us to ask it as part of like their vital signs, just like they would blood pressure, heart rate, and temperature, COVID vaccine status, and it's very yes or no. And then when I get the chart and I see that, and then I, do everything they need me to do, and then I say, "Oh, I see you haven't had the vaccine yet. We have it here, ready to go, super convenient. Can I answer some questions?" And that often helps too. So, like you had, Derek, making it super easy once you do get them, like take them by their hand. You can pretty much go to any pharmacy anywhere now and walk in and get one, but kind of go through that last mile to get them there.
Yeah, absolutely. I think that's such great advice. I kind of equate my experience to kind of like when I joined the service. Like once I raised my hand and signed on the dotted line, I was like, well, there's nothing else I can do now. I just have to
Right.
figure out the rest of this and make the most of it. Not to be, kind of
No.
flippant, but I
Right.
felt the same way when I got vaccinated. Like, all right,
Hmm.
well, we did this. Let's, we're all in this together.
Yeah. Yeah.
I didn't feel bad. But like one question I would have is there a chance that 2 years from now
Hmm.
that's the timeline we need, like, oh, now we realized something, or have we kind of, is this a good chance that if anything was going to happen, we would
Yeah.
kind of know, we would show, we'd have a hint? Do you feel
Yeah.
like we're there
Yeah. Yeah.
or not?
We have to look back in history to kind of understand. And generally speaking, one of the most kind of complicated vaccine rollouts was something called rotavirus, which causes like a GI illness and usually young children. And there were incredible kind of side effects that happened from that they saw like several months after, several weeks to months rather. But we feel very confident because we now, Derek, especially in the United States, because we had first authorization in December, so we are now 6 to 7 months into it. Most of the kind of things that you would expect to see or maybe even not expect to see, you usually see in the 3 months after the start. So we should have seen anything both in the trial data or trial population, which started even before December 2020, but then also people like me who got vaccinated in December 2020, generally elderly people and healthcare workers, correctional law enforcement, and we haven't seen something that is concerning. If you go back in time and you look, the Johnson and Johnson clot stuff, right? That presented within about 2 weeks. And
Mhm.
now there's a current, the CDC is going to discuss this week these cases of myocarditis, inflammation of the heart muscle. It's happened in over 200 generally young adults who received the either Pfizer or Moderna shots. And that was seen within about 2 days of the second dose.
Mhm.
So we generally see these things kind of in those months. I would say very confidently that we are in a period now where we can say that these are safe. And I see Pfizer applied for full approval in the beginning of April. That process takes generally anywhere from 3 to 6 months because the Food and Drug Administration has kind of what they do when that process starts. I fully expect Pfizer to receive full approval. Moderna will follow. I hope that gives people a little bit more confidence for those who have been waiting. But again, I think that to your point, I think that I feel very good that today we've had enough data and enough time to understand, like I don't want to say everything, but
Sure.
any major effects that would cause someone to say, I'm not going to get it and that's not good for me, we would have seen by now.
Yeah, no, and that's a great way of breaking down, and also just reassuring. It just that it makes sense, and I think that's a large issue that we're facing is that we don't have a, like, it's like a credibility issue. Like not
Yeah.
everyone can, talk to you or like have these conversations, and it helps. I hope this will help other folks too.
Yeah.
And something you mentioned that I think I'd love to follow up with. I think it's a really interesting question. Kind of lightning round style. What is something that you would go back and tell
Yeah.
Kavita 6 months ago or a
Yeah.
year ago? What's some info that you feel like would be super
Yeah.
helpful?
Number one, this is an airborne virus. We didn't have to wipe down packages. This wasn't getting transported on my apples and my groceries. So,
Mhm.
airborne virus, number one. Two, all things kind of quote unquote equal, which are not equal, masks mattered. So, we hemmed and hawed. I was even part of that hemming and hawing in the beginning. Like, no, don't wear a mask because it takes away from like doctors and nurses from getting their masks. That was ridiculous. We should have, this is an airborne virus. Masks matter. And then the third thing really would have been, we wasted, I would say, too much time on not having the testing. I mean, we just clunked up testing. It was nothing short of a disaster. So I would say that if I could go back in time, it would be to really, really, really think through like what could we have done, even if it wasn't perfect, to really rapidly scale testing in a way where you could get tested in your own home, even if it was not great and you had to then go and like go to a doctor to get it confirmed. That would have saved us a lot and probably caught a lot of disease early on. So those three things.
Yeah, and huge. I mean, any of those would have been, I think,
Mm.
transformative, but ideally, yeah, no, for
Yeah.
sure. And I think similarly now that again time has kind of passed and we have some time to look back on things,
Hmm.
to flip it, moving forward. Obviously, we never want anything close, to this happening ever again. But
Hmm.
what's something that you feel like we should like if we could take away one real, important nugget or two, like what's something that we need to either change moving forward or do better moving forward that we could hope would, assuage anything like this from happening again.
Yeah, had to think about this. So I think the knee-jerk answer would be, fund public health. And that's a very obvious one. We had no public health infrastructure. Doesn't matter what color your state, who your governor was, we would take away from public health budgets almost on a yearly basis in order to fund roads, schools, things that are like kind of in front of your face and you need. But short of being able to magically find, trillions of dollars to fund public health the way it should have been funded, I would say that we need to have every sector of society, by the way, this includes housing, transportation, national security, have a public health kind of approach and public health integrated. And every sector of our society, kind of both public and private, should have some approach to what to do if we have not just the lifetime pandemic, but we all kind of have these mini pandemics of sorts in different formats. Gun violence, outbreaks. If you're in Flint, Michigan, or in other parts of the country where there's lead in your water, you name it, right? There's just mini pandemic and kind of a mini pandemic in your own community that can happen, and having the ability to pivot that. I actually think this is something that veterans do incredibly well because you've had to adapt to unpredictable environments, and we need more of that and that knowledge and scale. We need that set of knowledge and skills kind of translated and taken to scale. So those are the things I would wish for the future.
Yeah, no, I definitely agree with that. And one thing I think that's obvious, hopefully, is that your wealth of information. Really appreciate all that you do with the on the ground work. That's important, but I think also spreading this information. That's great. And then in addition to that, even from your conversation last time with Jeremy and Jake, you've been able to provide quite a bit of hope in some pretty dark times, and I think
Mhm.
last time in particular. So to kind of build off that, is there anything now that's given you hope that you feel like we should feel good about or be positive about or know that there's something on the horizon, anything like that?
Yeah, I mean, I mentioned it a little bit, kind of, billions of dollars also being devoted to therapeutics and treatments.
Mhm.
There are promising treatments that can actually kind of prevent, if you had an exposure to COVID, even if you're vaccinated, that there could be a pill that you could take so that you don't have to worry and that it kind of prevents. I'm very hopeful that that is something not just for COVID, but could be adapted to other diseases, other viral illnesses. And then the second thing is really kind of resilience of people. I think that we get, I want to forget kind of the bad parts of the last year and a half, but I really am looking forward to, I think now when we see people, if we get to meet in person, we value that relationship a lot more. And I know this sounds cruel because we had to lose lives in order to kind of learn that, but I'm very optimistic and hopeful that like our interactions with people are just going to be more meaningful. And that also means cutting out a lot of noise in your life. You just don't need as many distractions or need as many things that take away your focus. And I'm really hopeful that we're going to be a better society, not just because we learned from like the lessons of the pandemic, but like we really value like people interaction, the value of like social connections, and also having the opportunity to have virtual connections. The fact that we can do this webinar, something now that maybe looking forward, we will have some of this continue. And I'm hopeful that that will expand like our global reach and people like you and me to be able to talk when normally you would only do this in person and it'd be limited to certain geographies.
Yeah, yeah, absolutely. Definitely hoping the same. And like I mentioned, just been tremendous. Really can't thank you enough for all the work that you do. And I feel like this would be beneficial. We did something like this every month. Like there's like a public service, you know what I mean? Like, but
Mhm.
since we can't do that, what's the best way for folks to stay in touch, check you out, or anything you have coming down the pike that folks can check you out at?
Oh yeah, I mean, I have now learned to take to Twitter, so I'm on Twitter, but that's not necessarily. I am happily going to resume my life. Hopefully, as just kind of a normal like healthcare person in Washington D.C. So, other than like trying to look for like any scholarly things I do at Brookings, I'm actually hopeful that most people don't hear from me anymore because we're kind of going back to normal in society. But I happy if people want to email me and it's easy. It's kpatel, KPATEL at brookings.edu. And I'm a pretty open, some people know me. I'm a pretty open book and tend to be pretty honest. So happy to keep the conversation going if people want.
Yeah, well, we definitely hope you don't completely, leave the limelight and some folks can stay in touch. But we appreciate all the work that you've done. Again, can't thank you enough. We love hosting events like this. We'll actually be having another one next Tuesday with Chris Kohler, the president of the Memorial Millbank Fund, to be discussing scalable solutions for implementing high quality primary care. So we'd love for folks to check that out and stay in touch with us as well. Dr. Patel, thanks again so much. Really appreciate this. Thank you for joining and look forward to hopefully doing something like this again soon.
Thank you.